Welcome to A Real Affliction, BPD Culture and Stigma, a podcast devoted to exploring how we experience, treat, write about, advocate for, and conceptualize borderline personality disorder. My name is Cynthia Gralla. I'm a writer and teacher with a history of BPD. Trigger warning, this episode will touch on illegal drug use and suicide. Over the past few years, advocates for treating mental illnesses with MDMA, hallucinogenic mushrooms, and ketamine have bloomed like night flowers. Also known as the recreational drug Special K, ketamine has been used to successfully treat major depressive disorder, anxiety disorders, and PTSD. In 2019, the US FDA approved intravenous as ketamine, but most insurance companies don't cover the expensive infusions. A 2023 article claimed that 41% of people suffering from depression responded almost immediately to the treatment, and 19% went into remission. It has also been shown to be effective in lessening suicidality. However, one researcher cautioned there is also potential for rare but significant adverse effects, such as irreversible bladder ulcers, and long-term dependence risks are unknown. Researchers have also been investigating the efficacy and safety of IV ketamine infusions for BPD. Ketamine infusions seem to increase neuroplasticity, which should help people with BPD who are seeking to change their self-destructive patterns of thought and behavior through dialectical behavior therapy and other forms of talk therapy. Yale University researcher Sarah Feinberg claimed in 2023 that her study, the first randomized, double-blind, placebo-controlled clinical trial of ketamine on adults with BPD, provides initial safety data and suggests that ketamine may help to improve depressive symptoms and promote functional recovery in this underserved clinical group. A study of treatment-resistant depression with comorbid BPD in the same year by Toronto-based researchers supported these findings. However, a 2022 report on the increased suicidality and recklessness in one patient with BPD following their ketamine infusions suggests that not everyone will react positively. The question of how formerly illegal drugs might be used by those with BPD is a timely one in British Columbia, where I live, because in January 2023, it became the first Canadian province to decriminalize small amounts of drugs for personal use in an effort to fight the opioid crisis. In this interview, I will talk with Lucy Yanow, who holds a master's degree in Bioethics and Society and formerly worked as a midwife, doula, and protector of reproductive rights. In this first part, I ask her about her experience taking ketamine pills for depression and suicidality, but our conversation detours in rich and surprising ways. Lucy opens up about how her family's history of suicide has affected her. She thoughtfully reflects on intergenerational trauma, the limitations she sees in talk therapy, and weighing the risks of drug therapy against suicidality. Her embrace of radical vulnerability in this conversation became a guiding principle for this podcast and for me. So, Lucy, thanks for coming today. And I wanted to start out by asking you about your mental health history or journey. What did that look like to you, and what were some of the challenges of it, either diagnostically or in terms of treatment?
Yeah, it's an interesting question. So I guess I'll start by sharing that the way I think about it is like I can tell that my brain is a little bit different, but I am undiagnosed, except, well, I have like a diagnosis of complex PTSD. So my great-grandfather, he committed suicide in Meningers in Kansas City I think in the 50s. He was 61 years old, and somehow he got hold of like a bottle and he broke it. And he slit his wrists like in a mental institution.
Wow.
His son, my grandfather was an alcoholic, and my family thought it was probably a good idea to send him to the same institution. And he checked himself out and committed suicide.
Oh,
And
wow.
his brother, I think they also sent him to Meningers, and he either before or after he attempted suicide.
Mm.
So if anybody ever tries to send me to Meningers in Kansas City, like don't
Yeah.
not a good place for people in my genetic line.
Is it a private or a
I think it's a
public
private,
hospital? Okay.
it's a private institution. I never met my grandfather. He died when my mother was 10. And I actually didn't know that he committed suicide. I was always told that he drank himself to death. He checked himself out of this institution and drank himself to death. And then I found a copy of his death certificate, and it had suicide crossed out and like accidental death put down. And that was so that his children could get some kind of money, or his
Right.
social security.
Yeah.
So I asked my mom about that, and she was like, yeah. And then my grandmother, so his wife, my mom was estranged from her until her death. So for
Mhm.
over 30 years, my mom always described her as a bipolar alcoholic. I don't know
Mhm.
if she was actually diagnosed. I just know that
Right.
she was pretty emotionally abusive to my mother.
Yeah.
So I have this kind of like family history of being adjacent to these sort of historical terms that could indicate some kind
Mhm.
of mental health diagnosis that could be quite significant, but we don't know what it was because it was all undiagnosed. It was
Yeah.
all past when things had
Yeah.
different names, right?
Absolutely. And people would have been less likely to seek out a diagnosis. And even in a hospital, they might not have been given one with that kind of
Exactly.
therapeutic privilege, the idea that the doctor withholds the diagnosis. And I think it was pretty common back then.
Yeah.
Yeah, I'm so sorry.
Thank you. I mean, I never knew any of these people, so it's just
Right.
information. So for me, I think my mental health becomes this interesting thing in my family because my mom has never really gone to therapy. My mom has no diagnosis. She's very
Mhm.
functional. I don't think she's depressed. I don't think she has any kind of, well, I think she's a bit of a hoarder. And I think she hoards
Mhm.
things so she doesn't have to deal with the emotions of this
Right.
very chaotic childhood and
Yeah.
parents that were quite unwell and
Yeah.
unkind really, and didn't meet her needs. So
Yeah.
anyways, my mom is a bit of a hoarder, but she doesn't really talk about it. But whenever, like, especially as a child, like when I was a teenager and I was rebelling, like one time I drank too much in high school and I ended up in the hospital.
Mhm.
Not great, but happens to a lot of
Yeah.
people. And it really upset her,
Mhm.
and I didn't really understand why she doesn't talk
Right.
about these sort of things. So I was sent to therapy in high school, and it was not the greatest experience. So I never really went to therapy again for a
Right.
really long time. So then fast forward, I'm 37 and I'm kind of struggling. I was really struggling. I had a terrible breakup. It was the middle of the pandemic,
Mhm.
and I was struggling in my work. I was really unhappy in my work,
Mhm.
and I was not coping there very well. Also, I had started to take kratom. I don't know if you know kratom.
No, I don't.
So kratom is an herb and it is legal in the US. It is not legal everywhere. Some people pronounce it maybe kratom, but it is an opiate analog. So a lot
Mhm.
of people who are addicted to like heroin will take it to get off of heroin. I had had a
Okay.
partner who was using and
Mhm.
was using and then using kratom, and he introduced
Mhm.
me to it. I started taking it, and it's not as severe as like an opiate, but I was
Right.
certainly skin addicted to it. And in order to stop taking it, I had to like taper it off,
Right.
which was horrible. And I went through pretty gnarly withdrawals. And I had kind of flirted with pills when I was in my undergrad. So I had
Yeah.
taken quite a lot of Norco for like a while. So I think my opiate receptors had kind of been opened. That's what a friend of mine said.
Mhm.
Again, I have no idea.
Right.
So a friend of mine shared that she suspected that like I was having such a strong, first of all, I had a really strong affinity to this kind of legal herb. And then I also had a very hard skin addiction and sort of like withdrawal experience that maybe not
Yeah.
everybody would have.
Right.
Anyway, it was pretty awful for me. It was right on the back of a breakup. And so I think coming off of kratom, going through a breakup, it was the pandemic. I was really unhappy and I was starting to have pretty significant suicidal ideation.
Yeah.
So I started lots of different things. I started to see a counselor, which was not a great experience. Again, it was
Yeah.
okay. It was not great. So I sort of changed jobs. I got a job at like an herb shop, which I also didn't love because it's retail and
Right.
retail's hard.
Yeah.
So, but I had a really good, for the first time ever, I had some health insurance and I also had Medi-Cal. So I kind of had this thing going where I had Medi-Cal and then I also had
Mhm.
I had this nice job at an herb store. And so they were like, yeah, you can use your HSA to pay for acupuncture and alternative
Mhm.
therapy. Well.
Oh, great. Yeah.
So suddenly I had access to a lot of care, whereas previously as a doula and a part-time worker, I was
Right.
working in a hospital, but I didn't have access to health care.
Yeah, which isn't unheard of, certainly in the US.
Yeah.
Yeah. That's insane though.
Yeah. Anyway, so I had ability to sort of access care for the first time, and the alternative therapies weren't really helping. I mean, I really enjoyed the acupuncture, but it wasn't like change like once I
Right.
left, that was no longer like it wasn't a
Yeah.
miracle cure. It was like, oh, I feel a little better for 2 hours.
Right.
So I was like, I think it's time to look at Western medicine. And
Mhm.
so I'm either going to take some kind of antidepressants, which might be great, or I'll try ketamine. And so
Right.
that's when I did Mind Bloom. So the way that that worked, you have a consultation on the internet
Mhm.
and they're very brief, and then you pay a lot of money. And I still had that HSA and I got it to cover
Right.
the Mind Bloom, which was really
Wow.
cool.
Yeah.
And then they just send you these pills and they send them to you with an antiemetic because they're really hard on your stomach. They give you some meditation tracks to listen to. So you just sit in your own room and you take ketamine pills. I think you dissolve them buccally. So I think you put them between your cheek and your gum.
Right.
And then you listen to these meditations. And I had taken ketamine recreationally, like at a party or something. And I remember that when I started my 30s, I started to get wild anxiety the next
Mhm.
day. And just like I would go out drinking or partying, and the next day just feel real terrible about everything. And it would be worse if I like did cocaine or
Mhm.
anything else.
Yeah.
Like I just was like, wow, I have like no serotonin. I
Yeah.
have no
Just totally
serotonin.
sapped. Yeah.
Yeah. When I did ketamine recreationally, I didn't feel that way. And it was like
Mhm.
actually for the first time ever, it was like my brain was really quiet.
Mhm.
So I had a really good sense that ketamine was going to be pleasant for me when
Right.
it was medicinal. And I really enjoyed it, but I didn't finish all of it because I started to get these really terrible stomach problems. So I don't know
Mhm.
if that was because it was going through my digestive system because I was taking it buccally, whereas I had been able to access the infusions, it might not have, I might have been able to finish it. So that was a little bit of a barrier for me. When I had taken a lot of Norco in at university, in my undergrad, I had gotten stomach ulcers,
Mhm.
but they kicked off when I started taking the ketamine. So I stopped. I think I did like 4 sessions. I must have done it for like 2 months because it's like every 2 weeks you do a session. Yeah, that was that.
Well, thank you for sharing everything that you did. I have a few questions based on things that you said. It was interesting that your family found it acceptable to say that was it your grandfather drank himself to death rather than that he died by suicide? It kind of suggests this certain hierarchy of what is socially acceptable, what is less stigmatized. I'm really fascinated with just the conflicting impulses we seem to have as a society around substance abuse. Like sometimes, oh, it's not a mental illness, so you can be blamed for it. Sometimes it's not a mental illness, so you can be sort of exonerated. Oh, we all get it. That it's like this floating signifiers. And I'm wondering, do you think that maybe that sort of influenced you in terms of being open to trying drug-based treatments, either natural remedies or something like ketamine, or was it more just the exposure you've had? Like you mentioned that you had a good effect with it recreationally. I have to say, I did too when I was in my 20s and experimenting with drugs, very much outside of any treatment construct, because this was 25 years ago. But ketamine was the one thing that seemed to calm me in a certain way without the horrible next day side effects. So I definitely get it. But I'm just curious whether you have a view that despite the risks, drug therapy might be more beneficial than talk therapy, or, especially because you've had some negative experiences with the latter.
Yeah. I mean, I think talk therapy is really great for people who don't talk, right? Like, that's just my experience.
Right.
And I know people who don't talk out their feelings, and that is just not my problem. I will talk to anybody all the
Right.
time about my problems, but I mostly just like cycle, right? Like, I'm
Yeah.
like, well, I mean, I don't know, maybe I'm a Libra, or maybe I'm just like anxious, but like I'll just like
Hmm.
I can go back and forth, and I do
Yeah.
it to myself in the mirror. And I'm
Yeah.
also pretty smart, I
Yeah.
think, and I know
No,
myself really
you are. I've talked
well.
with her before. She is.
So the problem that I have had with talk therapy, I mean, I know that there's a lot of people other than Freud, but I think that talk therapy has been constructed through the male gaze. I don't think we can
Mhm.
deny that. I think it's probably great for people who are more on the masculine side of the binary who don't talk about their feelings.
Right.
That is, again, not my problem. So I could stand in my bathroom, look in the mirror, have a conversation with myself, and therapize myself. And I have
Right.
yet to find a therapist who can like top that for me.
Hmm.
Like,
Right. I love that. I'll never forget that. That's a sentence. Talk therapy is great for people who don't talk. I have been seeing a therapist locally she's wonderful. And even at my first session with her, she said, wow, you really understand kind of where all of your struggles come from and your behaviors and the way you think. I was like, yeah, that's not the problem. I have a narrative. For me, it's so much about the detrimental thought patterns. So things like DBT and CBT have been helping. But yes, if you're highly verbal and open, I think you can go into therapy and say, well, what is this adding? I think having someone compassionate who can kind of push back against really negative self-assumptions can be helpful, even if you know what's wrong. At least I've found that. But on the other hand, I can really understand what you're saying.
I don't feel like I have any like universal beliefs about what everybody should do,
Oh, yeah,
um,
absolutely.
either. I think that everybody deserves all different kinds of care, whatever modality works for them. And
Hmm.
what I find, like for me, because I grew up and have mostly lived in the United States, it becomes this like capitalist. It's part of like a financial exchange. It's a commodified exchange. And as much as I'm like, oh, I'm an anti-capitalist or whatever, like as soon as something becomes a commodified exchange, even as a carer myself, I question like if their caring labor is not the care that I need and I paid for it, then I
Right.
kind of question its value and its worth. And I guess if I wasn't paying for it, right, I
Right.
probably wouldn't do that. I would just gratefully accept that reframe and that like positive like reminder or whatever. And when I'm paying for it, I'm like, no, I want
Right.
fireworks. Unfortunately, I haven't met the right match for me in terms of talk therapy, and I feel unwilling to pay for it anymore.
Yeah. I fully believe that the capitalist aspect of therapy is problematic and probably isn't discussed enough. It's like Mark Fisher said, treating mental illness as the problem of an individual has enormous benefits for capitalism. Pretty much no benefit for the individual. I believe these things are mostly societal problems. I mean, certainly we can have intergenerational trauma, such as it seems like might be one thing affecting your family. And we can have individual predispositions for how we think and experience the world, but it's a messy system. Another problem is one that you identified, this idea of therapy. Most of the therapy that's in circulation right now stemming from this model that's very much of a male gaze. And I'm wondering, have you ever had thoughts about what therapy that wasn't underpinned by the male gaze? What might that look like?
I would love to write a speculative fiction story about that.
Mm,
And even more than I would love to write a speculative fiction story about that, I would love to come up with a prompt to like encourage others to write that speculative
yeah.
fiction story. I was reminded recently, you know Charlotte Perkins Gilman and
Yeah.
Herland. So I
Yes,
read
that's a
that,
great one.
like 20 years ago.
Me
And I
too.
remember, and like it made me feel like a really bad anarchist and a really bad feminist when I read that because I was like, dang, Herland is boring. And I like kind of was like, maybe I don't want to like focus so much on utopia because I'm so messed up. I don't think I would be happy in a utopia. And so I don't necessarily know that I have the imagination, or sometimes I don't even know if I want to find a modality that works for me because I don't think that being like fixed is the work, I suppose.
hmm That in itself is a troubling kind of conception, I think, of mental health too.
Right. And that is a troubling thing. And it kind of feeds into this sense of like neoliberalism, whereas if I could just like, I don't know, buy the right kind of modality or something, then we wouldn't live in this like hell,
Right.
this hellscape. But also, like, I have a lot of privilege and I have a beautiful life. I have found returning to academia to be very therapeutic. My dissertation, which you were part of, which I'm like, was so enriched by your perspectives.
Oh,
And
thank you.
but to me, I was able to construct something that really I felt like I had to write autoethnography for part of it. I guess I didn't have to, but
Right.
I wanted to, so I did. Then
Yeah.
I got to. So I wrote
Yeah.
autoethnography and I like brought together all of these different threads that I'd been thinking about in different ways. And then I found other people who were thinking about these things. And then I found these like very legit academics who wrote these very complicated things
hmm
that I had also been thinking about. And
Yeah.
but to me, like actually returning to academia has been incredibly therapeutic. It's also really frustrating.
Well, I want to go over a few things. I will say I've had that experience too, where academia can be simultaneously incredibly nurturing and incredibly frustrating. I would say right now, teaching is usually a very regenerative space for me. I love just engaging with students. Similarly, some archival research I did into the journals of a woman who died by suicide, who had borderline traits, and that kind of feeling that engagement with her, even though she was no longer alive, that felt really kind of profound and intimate. But to go back to capitalism, the way instructors are very much treated by the administrators and the way the faculty is discouraging. I also just wanted to do a footnote for anyone who didn't know what we were talking about with Charlotte Perkins Gilman. She's a writer who's most famous for the short story The Yellow Wallpaper. And then she wrote a novella called Her Land. And I don't remember a lot of the details. It's a community of all women, and then a man comes in, and it's often this kind of separate from the rest of society. And I really related to what you said, that Her Land as a utopia, I didn't know how to connect with it either. Now, the yellow wallpaper, which is, well, I wouldn't even call it dystopian because that really was what it was like back then. You're a woman, you're depressed, here, just go lie in bed. All the weird things about wallpaper. I was reading that in a lot of cases of things like childhood trauma, especially child sexual abuse, the wallpaper becomes a really powerful image. You're staring at the wallpaper at these patterns. That story struck a much more profound note with me. I could relate to it more. So I'm really sympathetic to what you said there. I do have two more questions just about your personal mental health. One question is whether you ever worried about taking ketamine, given the fact that you knew that you liked it and that you had had a difficult withdrawal from the natural opioid. I forget what it was called.
Kratom.
Yeah, just because I know when I first started reading about how we're opening up drug treatment to drugs that are more associated with recreational use, illegal use, I know just for me, because I do have a history of addiction, it would be something I was concerned with. I figure some people might have that question too. Was that something that made you hesitate?
That's a really good question. I think it's complicated. So I was 37 and I was very depressed, and I found my grandfather's death certificate and I found
Right.
out that he committed suicide and he was 37.
Oh,
I
wow.
don't know if I
Okay.
told you that part.
No. Wow.
Yeah.
Yeah.
And then I found my great grandfather's death certificate, and he was 61. So
Mhm.
I kind of was like, oh, this is the highway to danger zone. Like I was like,
Right.
I always had thought about these like mental health diagnoses as something that you catch young. And
Right.
all of a sudden, I'm seeing this story in my own family where, like, 61-year-old committing suicide, he had 4 children. He had a wife, he had a successful career. I was just like, I have to do something. The other thing was that, I mean, I smoked cigarettes for like 10 years and then I
Mhm.
quit like this, like no problem. And
Right.
I started taking kratom. I didn't remember having withdrawals from taking Norco. I had never
Mhm.
considered myself as somebody with substance abuse issues. In
Right.
retrospect, I mean, I drank a lot. I
Mhm.
experimented with a lot of different substances.
Yeah.
But at the point that I started doing the ketamine therapy, the only thing that I had that physical experience with was with the kratom. And
Right.
even that I did taper off successfully.
Right. Yeah.
I am not an expert. I'm not an addiction expert.
No, but it
You
sounds like
know,
you have fewer addiction tendencies than I do.
kind of like what you alluded to before, right? Like there's these two different schools of like it's a disease. It's
Right.
completely socially constructed,
Yeah.
right?
Yeah.
I think it must be both to a different degree for everybody. I happen to be in a particular construct that has some tendency toward addiction and also seems to also be able to pull myself out of it. I was like, I need to do something because I'm in this space that
Right.
maybe I eat up, but I found, I was like,
Well,
I'm in my family suicide zone.
I mean, I can completely understand why you thought of it that way as this danger zone. And right. And at that point, it becomes what is the greater risk, more like risk management, I imagine. I do think it's really interesting this idea we have that mental illnesses, suicidality tend to be most acute in early adulthood, or what I would call early adulthood, 20s, 30s. I explained this in my first episode of this podcast. Just one of the things that prompted me to start talking about BPD, writing about it more, doing this podcast was because I had a really bad experience a couple of years ago when my perimenopausal phase started. And I had always heard, oh, well, if you can make it to middle age with BPD, it tends to get better. And it did for a while. But I've been talking on forums and with other women who have had a history of BPD and are going through menopause, and it's so rough for them. And there's no research on it. And then from that, I found out that actually for women, suicides do spike in middle age to late middle age. 45 to 64, probably because of the menopausal transition largely. I mean, I had the exact same surprise as you. Like, I thought I was past this, or I thought, if you can just make it to a certain age. But in fact, we don't talk enough about how this is a common danger zone.